y'all? It's Mikail, and I have a special guest today, my friend Dr. Samantha. She will be representing for Simply Faith. She is in the place of Terica today. Terica is out of town. Sam, if you want to introduce yourself to the people, go ahead.
What's up, Shades of Health? As my friend Mikael mentioned, I am Dr. Samantha. Shout out to Terica, girl. We'll see you when you get back. I'm happy to be here on the show today and just standing in the gap in terms of from a perspective of a nurse. My research, I look at, well, we'll talk about the topic, but I look at how we can improve the healthcare of vulnerable populations and to make sure that we reach our community. So I'm excited about being on the show on today. Thank you, Mikael, for having me.
You're welcome. All right. So today's topic is going to be about high blood pressure in the Black community. And so today's podcast episode is called Sodium, Soul Food, and Blood Pressure, a holiday reality check for our people. Before we get started, I'd just like to give this disclaimer. This information is for informational purposes only. It is not intended as medical advice. Please go see your doctor if you have any questions or concerns or any of these symptoms. All right, let's get started. Okay, Sam. So with you doing your thesis, your final project on high blood pressure in the Black community, specifically affecting Black men, I guess you can give a good definition of what high blood pressure is. So can you
Okay.
just break that down for us?
Absolutely. So, what I like to do is simplify things for people, especially just coming from a nurse and want to empower patients. I think it's important that we give them information that they can understand. So, high blood pressure, your blood pressure is high. Okay. It is outside of a normal set range. And we used to have the textbook number 120 over 80. For some of us, and I can be real, right? So for some of us, it can be a number, but for people in our community, high blood pressure is sometimes that thing that doesn't escape everybody. Everybody's eventually going to get it. It's like a birthmark in our community. And so what I will say is what high blood pressure is not. It's not stress. It's not I ate too much salty food. These are things that lead to high blood pressure. High blood pressure is a chronic condition that impacts the blood vessels that are running through your body that carries all of the oxygen and the nutrients that we need for each of our vital organs, our brain, our heart, our kidneys, from the head down to the toe. And so we measure that with a number, two numbers, the top number, bottom number, that indicates what how our pressure of our blood vessels are performing. And so if we have too high of a number that reaches outside of a range and we are exposed to it consecutively, it's not coming down with sleep, stress management, all the things that we try to do to try to fix it. If that number doesn't come down, then of course we'll go to our lovely nurse practitioners and physicians and they'll give us that diagnosis of high blood pressure.
Absolutely. Come on, Professor. Okay. Also, I want to say happy NP week to all the NPs out there. We work hard every day. So shout out to us. Also, this podcast is supported by Lighten Up Weight Loss. So if you're interested in weight loss, please DM us. But anyway, back to the episode. So I did have a little chart of like what blood pressure, the numbers look like. So technically high blood pressure or stage 2 high blood pressure is 140. The top number 140 or higher, and the bottom 90 or higher. And then I read a statistics from the American Heart Association that said 55% of African Americans have high blood pressure. So that's over half of us. So that's pretty concerning numbers. And some things that I've heard in practice are that, like you said, this is something we all have, that this is something people may, eventually step all Black people with. And it's not necessarily so. Everybody doesn't have high blood pressure. However, if if we continue on with a high salt diet and not exercising, and gaining weight, then more than likely you'll have the diagnosis of high blood pressure. Anywho, let's see. Let me take this off.
Okay.
All right. So you can read this question, or I can read. I'm gonna give this one to you too, Sam.
Okay.
Does high blood pressure seem to disproportionately affect Black people or Black Americans?
That's a great question, and I'm so glad that you asked that because, like, going back to the point of, I know in our culture, a lot of times we're just so common, we're used to hearing that oh, you Black, you have high blood pressure, hypertension, and so we think that it's automatically just inherently connected to being Black. And so we think about the experiences of us and being in our culture. We think about the different factors that impact us being exposed or being predisposed to having high blood pressure, food that's in our diet, our environment. Sometimes we may not have access to adequate health care, preventive health care, things in our environments that we may be exposed to with toxic stress, and all of these different factors, what we call in our profession, of course, Mikail, this the social determinants of health. All of these different social factors that are at every level, that impact our ability to get access to the type of health where we can focus on prevention. And so these different factors disproportionately impacts us and put us at a higher risk of developing this disease.
Yeah. So you kind of got into the next question. How? Well, I guess I can go up next to it or bring it on up. What role do social determinants of health, like the neighborhood environment and access to healthy foods, play in hypertension rates among Black people? So, of course, when you go in certain neighborhoods, they're called food deserts, where they don't have healthy options. They don't have grocery stores that are close to them, and the ones that they probably do have in their neighborhoods don't have as fresh of foods as you would have on another side of town. So, and a lot of these people don't have the money to pay for better food. So, like, it's cheaper to buy processed foods. It's cheaper to go get a pack of ramen noodles, a box of cereal, because it's way more expensive to buy like an apple or a banana or things like that to keep your body healthier. Even though they may have like food stamps or different assistance, they may not have transportation to get there. So they may go up the street to Popeyes. They may go up the street to Wendy's and get a $5 meal, and that's they're just trying to survive for the day. So they play a huge role in high blood pressure rates, and typically, depending on the community or the environment that you're in, it'll start at an early age. So you may see a 30-year-old or a 25-year-old come in 200 or 300 pounds and have a blood pressure of like say like 150 over 100, and at the age of 26, that's extremely high. That's something you would typically see maybe in an older adult, maybe in their 50s or what have you. But yeah, so environment plays a huge role in a lot of chronic illnesses in our community.
I agree. And one of the things I thought about as you were talking, we can't take for granted the hereditary component too.
Mm-hmm.
Because, if it runs in our family, we're at a higher risk of developing high blood pressure. And then also the culture of health that we grow up in. If you are in a culture that doesn't prioritize, or you grew up in a family environment that didn't prioritize preventive things like going to the doctor, getting screened, then it just trickles down. And so you may wait until you experience a symptom. And so a lot of times we know that high blood pressure is coined the silent killer because it doesn't have symptoms. And so symptoms don't usually present itself until there's some type of secondary malfunction. Say, for instance, that you've gone so long with high blood pressure, not treating it. And of course, this, it might go into heart issues where you start to lose oxygen to your heart and you start to get chest pain, and that may be the thing that causes you to go to the doctor. Or you may start seeing issues with your kidneys, your kidney function, and different things like that. Those are the things that those are the things that drive us to go get help, when at that point you may limit the ability to treat it without medications. And so I don't
Right.
want to go on into all the different things, the consequences of not treating it, but just some of those factors that lead up to us being disproportionately, predisposed to high blood pressure.
Absolutely. And I've had a lot of, and these are the side effects of having high blood pressure for a long period of time. That has gone either unmanaged or not appropriately managed. But I've had patients. I mean, of course, I deal with a very specific population. So a lot of them, their blood pressures walking in, a normal for them would be 230 over 120. So for most people, that'll be, oh, you need to go to the hospital immediately. But for them, that's a norm. So a lot of them, when you do put them on medication, they're automatically starting off on 2 to 3 medications at a time. And a lot of it is a shocker to them because it's like, man, I ain't never had high blood pressure. But you just didn't know it because it's silent. And when you ask them, do you have any symptoms? No, I don't really have any symptoms.
Mm-hmm.
I'm good. But my head has been hurting or my vision is changing. And it's just like, look, more likely that's your blood pressure. So we need to get you on something. And in that moment, you kind of skip the process of let's try lifestyle changes first, because it's important to go ahead on and start you on something to decrease your pressure. And what I want to tell my people is that we're not here just to put you on medications, just to put you on them. I'm putting you on these medicines because you need them. And if I don't, you're going to probably end up in the hospital in the next few days to weeks if we don't do something quick and fast. So also, I want to throw away that mindset or that myth that providers are just giving you medicines just to give them to you because we're trying to make money. Like, nah, I'm not here for, it's other ways to make money versus putting people on just medications and having you come back every week, 2 weeks to a month. So
Listen, see, I'm so glad that you said that because it brought back the thought of what I did, with my research. I had the opportunity to talk to Black men in our community, and that was one of the common things that came up, about the money aspect. They're just trying to get me, they want to keep me on these medications because there's some type of financial gain that comes from it. We don't get paid for that. If anything, we're trying to limit and reduce the amount of medications that you have to take because we know how it could potentially impact your quality of life. And so the misconception I would think would be that you don't need blood pressure medication. Sometimes you need blood pressure medications to control your blood pressure. Control is not, when you think about blood pressure control, it's not, oh, well, I don't have any symptoms. If that's your target and that's your goal, then you could be walking around blood pressure 160, you don't have any symptoms because your body has adapted to that, but it's still unhealthy. It's putting more strain on your vital organs and it can't handle it for a sustained period of time. And so it all comes, I see it clearly. We see it clearly because we're working in this space. But for our lay people who don't have the privilege of the information that we get a chance to interact with as clinicians, all you have is to depend on your family and your friends and searching something on Google or watching something on TV. And depending on what it is, the information that you may get, it could be right or it could be wrong and different, or it may be good, but it just might not be applicable to your situation. And so I think that a lot of times we depend on outside sources, outside of the medical establishments, which I can see and understand why, just given the impact that certain institutions have had on us as Black people in medical environments. Let's just be honest. We haven't always had the best, most trusting relationship with healthcare. And
Absolutely.
so that has been passed down, which at the end of the day, it impacts our ability to fully
Mhm.
trust healthcare providers. So
Absolutely. You made some very valid points there. I'm trying to think misconceptions that I've heard. Similar to you, I I didn't have high blood pressure until I got here. Oh yeah, white coat syndrome. I want to talk on that a little bit. Um, I'm just trying to figure out, y'all. Like, I don't even wear a white coat, and I'm trying to figure out how is it that you nervous, and I'm not even wearing my white coat. I'm just playing, but like, if you come in and your blood pressure, let's say, is 150 over 100, that is not white coat syndrome. That is high blood pressure. White coat syndrome is typically a small elevation above your normal, which would be, say, if you are normal, say 120 over 80. White coat syndrome may be 125 over 85. And if I recheck it, it goes back to normal. It don't go up, you know.
yeah.
Blood pressure is not gonna go up. That's not white coat syndrome. And I just also misconceptions are that they only need to take their blood pressure medications when they feel like they need it. That drives me crazy. You don't even know you need it to begin with. How you gonna know when you need it when you need it? I'm just saying, take your medicine every day at the same time so that we can control your blood pressure and we don't have to keep adding to you, because there's a point where it can be so uncontrolled that we can't control it, and then you got an issue with your kidneys. You can go into heart failure, and then that's a whole nother situation that we're trying to avoid. So take it seriously in the beginning, and let's work on lifestyle changes so that you can go on and live a healthier life. Um, Let me see. Another one was, I don't feel good when I take the medicine. Mainly, it's because your pressures are so high that when you take the medicine, it's finally getting you to a normal pressure and it makes you feel weird. I'm not saying if it just completely makes you feel bad not to talk to your provider, because there could be a problem, but more than likely it's getting you back to a normal and your body is just not used to being at that normal. So you feel a little off.
That
Anything
is
else?
true. Yeah, I wanted to add that, certain medications do come with certain side effects.
Mm-hmm.
And, I'm not going to say that, put all the burden on the patient and these people that are coming and entrusting their health to their providers. I'm not going to put all the burden on them, because we can do a better job of explaining those things, right? And
Mm-hmm.
try to reach them on their level where they can understand, or just modify the way that we talk to patients so that we can hear what they're asking us instead of assuming, so that we can get to the next patient. And so knowing that, I'll put it like this. One of the participants in one of my studies where I talked to men, they put it where after we talked, they said, man, it's like when it comes to my dealing with this high blood pressure, I've completely avoided it. I've given all the power to my provider, to my doctor. And it's like I'm taking my health, and we're just likening it to like a car. I'm taking my health and driving it into their garage. And
Mm-hmm.
so you think about who really holds the power to help to control your blood pressure. You do, as the patient. And I think that that's a common misconception, that all the work is on your provider. No, they only hold the amount of information that they can give you to help you to improve from the disease standpoint. But you're the one that actually has to live with it. And so I would just say, for us in our community, don't avoid taking control over this situation. All of this is literally, not everything doesn't fall on you, but you play a huge part in this, and you have more control over this than you think you do.
Because at the end of the day, we're not at home with you. Like, you're there for a short amount of time. And 9 times out of 10, I'm following up with you because I want to see what you've done at home to make a difference, or to see how you've progressed. So, like, if I give you a 30-day supply and I say, hey, take this medicine, make these lifestyle changes, write down your blood pressures, and bring them back to me, I want to see what we've done. Please pick up your medicines to begin with. Like, don't just show up and you have not taken your medications. You're taking them every other day. Like, you're just not doing your job, and then you're frustrated when you come in when things are not how they should be, and then you're mad at me when you didn't take your own, take the responsibility. So just look at it as like a job. Like, take it seriously. Like, take your appointment seriously. If you have questions, I always say write them down. Do not leave that appointment until it has been broken down to you to where you can understand it, because it's your body, it's your health, and only you can deal with that. Only you gonna deal with that when you get home.
Absolutely.
Right. Cool. Okay, so here's one. Being in the South, and it's holiday season. We are in November. It's about to be Thanksgiving. Turn around. We're gonna have Christmas, and we like to throw down. So it's
True.
the truth.
True.
How do traditional holiday dishes impact blood pressure, and are there ways to enjoy them without compromising health? And I can take this one because I've been, or read the question, but it's cool. How does it impact our blood pressure? It can have a huge effect on our blood pressure. Most of the foods that we cook is going to be highly salted, highly seasoned. If we could just find ways to not add as much salt, like just find alternatives, not add salt to the food because it's already seasoned with it, then I think that would actually help mitigate some stuff. Take your medicines as you should. And I'm not saying double dose yourself before you have whatever you eat. But take them as you should. When you get done eating, get up and walk. Do something that's going to lower your blood sugar and your pressure. I know people double dose themselves so they can eat their cake.
I should. This gonna cover me. I'm gonna be good. I ain't gonna get no swelling because I'm gonna take it. Yeah, right now.
You have to live outside of the holidays, y'all. Like, it is a day that we celebrate and enjoy, but think about your health. You don't want to be in the hospital. If Thanksgiving is on Friday, you don't want to be in the hospital on Saturday because you overdid it. Like, think about tomorrow. There is a tomorrow. I'm not saying not to enjoy yourself, but we don't want you to overdo it. Go ahead, Sam.
I was gonna say it ain't worth it. It just make me think about just working on cardiac units back in the day, and working the holidays. That's when I would see all of the acute kidney injury, the CHF exacerbate, congestive heart failure, swelling, because they overdid it for the holiday. And I agree wholeheartedly. As I'm over here listening, it's so good that we get a chance to have the dual role. Like, okay, I know as a clinician these things, but then I'm also human too. So we empathize, we know. So some practical things, start to get accustomed your taste way before you get to the holiday. Like, practice on the dish, practice on some seasonings that you may like, that you can grow accustomed to, and prepare your meal that way, or maybe have like a separate dish, with your low sodium things. Just small changes, they truly make a difference. You don't have to go and do the extreme because some people can't handle that. And so we'll get to talk a little bit more about how our culture impacts these things. Some people for some of us, you take my food away, you're taking away my identity. This is how I identify with being Black. I can't go up here and show up mac and cheese and I got the low fat, low sugar. What? They're gonna laugh me out of town. I can't do that. I can't have the low sodium greens. I'm sorry. Am I drinking what?
To piggyback off of that, and I know when we pull up, everybody is bringing a dish, so maybe not eat as much. Like, portion out what you're eating. Maybe not go back for that second. Like maybe go walk around, then go eat you some more, then get you another plate, then exercise. Go, try to figure out how to compromise with yourself. And I would say drink water. Don't drink a lot of soda or juice or alcohol. Don't liquor it up. Because that's going to add to your diabetes or your high blood pressure. On top of the foods that you're already eating. And I will say, like being a Black clinician, I can identify with my patients, and that's one thing that they love. Because when we start talking about food, and I'll be like, I know how y'all seasoning these foods because we doing the same stuff, and they just start laughing. They'd be like, you're right. And I'm like, okay, so if you seasoning your chicken, you don't have to use garlic salt, onion salt. You can use garlic powder instead, onion powder instead, and then add your salt. Don't use Tony seasoning plus the salt plus then you putting on like 4,000 or 5,000 milligrams of salt.
Mm-hmm.
If you're gonna use that particular seasoning, like they're what do they call, like they're already made seasonings with all the different ingredients in it, or like seasoned salt, just use that. Because I found that a lot of people don't know they're adding salt on top of salt on top of salt. And so then it's building a tolerance for salt. And what we would consume and be like, oh man, that's really salty. To them, it's not salty. I have witnessed people put salt on their salads. And I'm like, the whole point of the salad is to eat healthier. I mean, if you don't do that, just go ahead and eat what you gonna eat. I also say this, and I might be wrong, but like even if you're a vegetarian, if you cooking your veggies the same way I would fry some chicken, you might as well eat the chicken. Salt, all the seasonings that make it taste good is still doing the same damage as the protein. Like, just think.
I'm not gonna even go there. That's a conversation for another day. Because, you know what? I'm gonna leave y'all vegetarians alone. I'm gonna leave y'all alone. We focus on the high blood pressure, but the carrot dogs, the mushroom steaks, the mushroom Philly cheese steaks, the cauliflower, boneless chicken wings. Let me tell you, you might as well just go ahead and stick to the meat.
All you doing is making yourself hungrier.
Yeah.
Just go ahead and get the wings, drink your water, and figure it out tomorrow. Okay. All right, y'all don't fight me about that. Don't fight me.
Hey, look, I'm ready. I'm ready.
So, okay, we're gonna move on. Let's see. So, what role does stress and family gatherings play in raising blood pressure and how people prepare mentally, emotionally?
I mean, first acknowledging that it is stressful, and I think some of us don't recognize that there's stress associated with it, because food is so cultural, and family gatherings it's so cultural. We've always done it this way, and so tradition that's just a part of that's just us. You know what I mean? And so I think that it comes to, you can't wing stuff on the day of. I think we got to have conversations prior to us being in this situation, us at the dinner table, us planning the menu. However, like, look, this is something that I need help with. This is something I need support with. You know, this is what I'm choosing to do. You know, here, this is what I'm choosing to eat. I'm not acting funny. I'm bringing my salad to the table. I'm bringing the salad to grandma's house, okay?
Yeah.
Mikail, come on now. I done got these part of these beans over here, and I got some good ham hocks in there. Mikail, you don't want none? Like, don't get offended if I don't want to eat. And I think people sometimes take offense to it. So just know that they're trying to do something different and reverse the blood pressure. But it's stressful. I don't know no way no way around it, you know.
I mean, I think one thing, you just can't make people feel bad for doing something different. Also, I want to add that food is not bad or good. Is it appropriate for me in this moment? Is it going to be beneficial for me in this moment? because you can't put a moralistic value on food. God created it for it to be good to us. The problem is how we're seasoning our food and how much we're consuming with the food. So that's what's affecting us. And I will say, as Black people or African American people, our soul food is not bad. Cooking collard greens and cabbages and okra, those are the best foods you can eat. It's just what we're seasoning it with and how much we're seasoning it with. So I'm not condemning our food, our culture, or anything. I'm just saying, guys, we gotta do better. Because if not, then when we get 50 or 60, then here we go with the blood pressure medicines. In our young age, that's the time for us to create healthy habits. So that when we get older, as life starts to happen, our metabolisms break down, then we have those processes put in place where it's like, okay, I see myself getting to this point. Let me get out here and, walk or do something. So it's just about having self-discipline and control. Stress and family gatherings can be stressful because let's say you are doing something different and you worried how people gonna perceive you because you bring in, what you say? I don't
Salad
even
and rice cakes.
Rice cakes, like, yeah, they gonna probably check you for that.
They gonna take them and throw them in the trash.
I would just say, just take it easy. Like,
and look now, if Uncle Earl, now I don't, if there's any Uncle Earls out here, this is fictional to me. I don't know Uncle Earl, okay? But if Uncle Earl already told y'all that he watching his sugar, he watching his salt, don't throw it up in his face. Like, look at him. He didn't want to eat none of the, he didn't want to eat my this and he don't want to eat my that. Like, don't do him like that. Be supportive and just go on. Don't even have a comment. Just support them. Let them do what they're gonna do. Don't make people feel bad for choosing to do something different.
Mm-hmm. All right. Is it possible to enjoy alcohol responsibly without negatively affecting blood pressure?
I mean, with everything, and I'm surprised I haven't used this word, everything within moderation. You can't overdo it.
Mm-hmm.
I don't know what the recommended, amount is, but I'm pretty sure overconsumption, of course, is going to negatively affect the blood pressure. So just things in moderation.
I would say yes. Responsibly, I would say if you got any type of chronic issues like diabetes or blood pressure, both of those work hand in hand with each other. So if your sugar high, it's going to affect more likely your kidneys, which is going to probably affect your heart. If you gonna drink, let it be one of something and let it go. That's all I'm gonna say. One of something.
One or none.
One or none. And let it be that. Moving on.
Okay. Oh boy.
Don't move past that one.
Okay, because I like that was a visual. Oh man.
I did too. It's a visual.
Okay, Kel. So I'll take this next question. It says, how does high blood pressure impact long-term health, and why is this particularly concerning in Black communities?
That's for me?
Yeah.
Okay. How does high blood pressure impact long-term health? Long-term health, like we've been talking about, it affects your heart, your brain. You can have a stroke, you can have a heart attack, you can have heart failure, you can have kidney disease. It can really cause some problems. So long-term is concerning for the Black community because, like I read, we are 55% of Black people have high blood pressure, which means over half of our community, our race, is already stricken with a chronic illness that could potentially kill them if they don't take it seriously or do what they're supposed to do. It's concerning because for some reason, Black people are high on the list for everything. And it's just, it's tough because it feels like someone has already cursed you to say, hey, when you get this age as a Black person, you're more likely to have this. You're more likely to die from this. It's just like with the breast cancer thing. We're more likely to die from breast cancer. We're more likely to die from this. Like, it's concerning because we really need to focus on things that are important to us. And now I'm finna get on my soap opera. I do feel like we focus on things that are not as important, but more entertaining. And then when things happen to us, we don't want to hold our community or ourselves accountable. We want to blame somebody else for it. When we have all the tools, we have people in our communities who are doctors, who are educators, who are nurses, who are policemen that are here to educate and give back to our community, but it's not taken seriously because it's not entertaining. I do feel like with our community, we just, if it's not dysfunctional, if it's not humorous, then they don't pay any attention to it. So it's concerning because I'm tired of us being affected in high rates when sometimes we can really make a difference or kind of at least try to stop it. You know, it's not always
Absolutely.
the others.
Absolutely, absolutely. And just to add to that, I think, with the long-term impact, we don't think about a problem as a problem until we get the problem. And so we don't look down the road. And all right, it may have started it. All right, my blood pressure was a little high. I had to take this one pill, and with this one pill, I would have been straight. I would have avoided the impact of having uncontrolled blood pressure and how it would impact, lead to a stroke, congestive heart failure, chronic kidney disease. But then we don't see down the road that unmanaged blood pressure, that out of control blood pressure led to having to be on dialysis. And that we hear that and we know, we know somebody on dialysis or know somebody that knows someone that's on dialysis, but we don't really understand how that impacts your quality of life. You being able to get up and go as you freely want to go, but you can't because you have to be in a dialysis treatment center 3 days out of a week. And so we don't look at the long-term implications on our quality of life, having to take multiple medications to manage multiple other conditions that started with this one issue that could have been managed. And that's one of the things that I didn't mention earlier about the misconceptions, particularly high blood pressure. It can be treated. It can be the risk factors for it can be modified where you don't even have to deal with this. And so I think a lot of times we have this learned helplessness as it relates to dealing with high blood pressure that, well, it's just the end of my life. Well, it just is what it is. Like, no, there's things that are in place to help us to manage it. And it's not a a death sentence or something like that just because you get it. Like, you literally can have a good quality of life even if you have it. The whole goal is to manage it so that your body isn't being stressed due to being exposed to those high pressures and the long-term impact that it has on your vital organs. So
you made a valid point when you were like, it's not a death sentence. I want to say a lot of things aren't a death sentence anymore if you go and get it seen or checked out in the very beginning. Like, if we stop letting fear stop us from going to our providers when we first notice something, instead of pretending like it's not there, a lot of these things can be fixed and treated and managed, and you can move on with a healthy life, a healthier life. So I think we hit the nail on the head with that one.
yes.
All right. How can families support each other's health during the holiday season instead of encouraging habits? I mean, we kind of already talked about it. Just stop making people feel bad. Maybe have alternative dishes. So this year, maybe not have, let me see, fried chicken. We have baked chicken instead and use less sodium. Just try to have some alternative stuff. And another thing I want to say, a lot of times when I've diagnosed patients with like diabetes or high blood pressure, it's like they feel like their life is so much different that they can't eat anything. I've heard so many times, I might as well not eat nothing. I can't eat anything. No, I'm not saying that. Like, what I'm telling you is something that we should have been doing a long time ago. And it's not that you are modifying your diet, but you're just making your diet healthier. Um, yes, you can eat. There's a lot of foods out here you can eat. It's just how we're eating and what you eat, you know. So yeah, just be supportive of your family member.
Yep.
What are the best ways to advocate for yourself in a healthcare setting if you're at risk of or currently managing high blood pressure?
Yeah, let me start. I truly believe in the power of equipping yourself with education.
Mhm.
So even before you go to the doctor, as Mikail mentioned earlier, or your nurse practitioner, whoever you see to manage your to help assist you with managing your health, look up some information before you go. I know some doctors don't like when patients come in, well, this is what I found in on Google. Like, no, they a lot of times they're equipping themselves before they go into the room so that they can kind of keep track of what it is that they want to say or the things, the information that they're interested in. So do yourself a favor, look up the information. Don't let that be your sole source of information because you might not have the discretion to be able to determine, does this apply to my situation or not? This may be general information. So education, looking up things, writing your questions, as Mikail mentioned, and making sure that you advocate in terms of, I have questions. So making sure that you speak up so that your provider will know that, hey, that there's some things that they must address. And if you are seeing someone who does not want to listen, take the time to listen to the questions that you may have, and it might not be a good match because every provider is not for every patient. Do
Mhm.
yourself a favor and go and find someone else that's within your network that you can go and see. No harm, no foul. Don't wait on someone to delay your care when you can get things addressed because as this clock ticks with you not being able to address the issues that with your blood pressure, so is the exposure to your body not being able to get what it needs so that it can get back into that state of control. So education, look up information, ask questions, and quickly find you somebody else who, if they won't listen to you, there's nothing wrong with it. Find
Mhm.
someone else.
I agree. Advocate for yourself. Just go in prepared. I'll also say like there's nothing wrong with going ahead on it and having your own blood pressure machine at home just to see where you're at. That can also be how you can be proactive as well. You'll know, okay, well, my blood pressure is really high. Let me, make myself an appointment. Because the quicker you can jump on it, the better, like Sam said. And I also want to say the longer your blood pressure is at an extremely high rate, if it's not being managed, so let's say if it's 150 over 100 and then the next day is 120, like it's up and down, what you're doing is wearing out those vessels and those arteries, and it's stretching your heart out. And once it gets stretched out to a certain point, then you go into heart failure. So it's important to get you on a regimen, you stay on that regimen, so your heart can continue to beat as it should and not give out before it should.
Yes.
Should Black Americans be taking more proactive steps like regular blood pressure? Yeah, we just talked about that. Absolutely.
Yes.
Absolutely. Be checking yourself. With the new year approaching, what are some realistic, attainable goals to lower blood pressure and maintain heart health? Exercising, low sodium diet. Google is your best friend. If you want to know foods that are like low in sodium, some seasons you can use. How much salt should we be taking in? It's just a simple Google search. Um, Also know that salt draws in water, so if you're having issues swelling in your legs and your feet, more than likely you need to check your salt intake. Also, certain foods can increase gout, so a lot of the stuff that we eat contributes to a lot of problems that we have. Um, get you 30 minutes of exercise in a day if you can. Even if you can't walk, you can move your arms. Go on YouTube, find you some exercises. If it's just this, something to get your heart rate up.
Do it
Okay?
again.
There's no
Do it
excuse.
again.
I'm not fooling with you.
Hey, it works.
It is no it does. If you're in a wheelchair, you can roll those wheels, okay? Anything to get that 30 minutes in. I'm for real. I'm not playing. I'm serious. Because all we're trying to do is get your heart rate up, sped up enough to try to burn some calories. Um, so, and I'm not saying get out here and hurt yourself, but we do a lot of different things that we can do that's within our reach. So let me see. I think that's it, fam. I guess for this holiday season, I would like for us to be intentional about making choices that protect our heart health. So starting by tracking our blood pressure, maybe finding some healthier recipes, or setting a manageable goal for the new year, so that small changes can become big improvements. So again, if you're interested in losing weight, you can always hit me up. I own Lighten Up Weight Loss. I'm here to help any way that I can. Thank you, Sam, for being my co-host today. I really enjoyed you. You had a whole bunch of knowledge. Hopefully, I can get you back later on in the future. I'm sure Terica really appreciates you. You got anything else you want to say, Dr. Sam, Sister Sam?
Thank you, Kel. I enjoyed this. I appreciate it. I hope that, of course, we said something that can impact our community. Terica, you do a great job holding this down. It's not as easy as it looks. So I really appreciate it. Enjoy watching you and Kel together. This was really good.
All right. Well, thank you. All right, y'all. Be good. Be great. Enjoy your holidays. Be safe. We out.